important 10 minutes can be, even if it means that they can save someone's life. Sometimes health screening can take up to 10 minutes, the maximum, to be able to screen for any health conditions, such as blood pressure and blood sugars. These conditions may not be severely asymptomatic. They may be asymptomatic to many of us until it's very, very severe. The sad reality is that not many people do the early screening detection because due to the reasons of being too expensive, too far, and not even being able to transport quickly to the screenings, or so they're not available during the times that they are wanting to or they have a chance to assist to these screenings. Usually these people do have the screenings performed until it's an emergency when they have their symptoms very, very severe and they need medical treatment as an emergency. CDC in a peer-reviewed public health studies has shown the lack of access being the biggest barrier for the lack of the early detection screening in any community. Now that we know the issue, we need to understand why many communities members have missed early detection screenings. The biggest barrier is the cost. Many people don't have insurance, or even if they have insurance, they have to do the copay, the deductible, which is more than they usually have to pay for the monthly payments. And that is why many people think that doing the screening is not important until they develop symptoms. There has been strong evidence, according to the 2023 NIH community-based screening study published on the PubMed, that shows that underserved communities show significant low screening because of the low cost, the cost due to the limited access of the lack of awareness. So even if it's free, even if it's low cost, many people are not aware. They don't have any knowledge of where to assist, how it works, or they believe they need to pay something later on. And that's why they don't assist to these low cost screenings. Another issue would be the transportation. Many people do live far in the rural areas where a clinic, a screening, a campaign can be maybe 20-30 minutes away, and sometimes due to the traffic, due to the time, they don't think that they are able to meet the time. And also the time that they provide the services, it may be from 6 to 8 in the afternoon or during midday, and that's on the time that when they are able to work. So the transportation and time do are together, meaning that by the time they get there, it may be the time that they have closed or it's last minute and they can attend to. And the awareness of being able to go. Sometimes, as mentioned, they believe that they have to pay something or it is expensive, so they aren't able to attend to these services. The CDC 2022 National Health Statistics Data Brief Report have shown a large portion of healthcare visits being usually for preventative screening, meaning for blood pressure, blood sugar, vision, cholesterol, as well as health education, meaning sometimes it can be for diabetes management, for cholesterol, or for any kidney diseases. But when screenings are early to access, these emergency visits or any other treatment visits can be treated with less severe conditions, and small problems can become less serious emergencies. Now that we understand the problem and the cause, we need to put a realistic goal for the community. So the one way we can solve this issue for the community is expanding the free or low cost community health screening events. We can do these at schools, giving the children's letters to show their parents to take them for low cost vaccines, as well for themselves for diabetes or diabetes management or screening, as well as churches. Churches do come together as a big community as well. Besides the city population, they do come together and they talk. People do mention to each other to encourage one another to visit the church for this free screening or the low cost, because most of the people sometimes don't go for any screens due to the money or being scared or not having support. As well, we can do it at libraries or at community centers when mothers or fathers drop off their children for sports events, libraries, or any activities that they want to do. They can take 5 or 10 minutes for a quick screening while dropping off their child. And we can do the screenings for blood pressure, for hypertension, medical treatments, blood sugars to see if they are needing to lower their number, if they have time, or if they need treatment as soon as possible to prevent any a patient going into coma or having any infections that can't be treated due to their high blood sugars. As well, we can also screen for BMIs to see if they have acidosis, or maybe it's a hormonal condition that is going on, or we can also do vision checks even for children. Sometimes having hard vision can cause headaches, any other medical conditions, as well as like the muscle strain. And then these screenings can take less than 10 minutes, as mentioned. When dropping off a child for any activities, they can take 10 minutes to be able to do these screenings. And according to the 2023 NIH committee, intervention studies have shown that early screening has significantly decreased the number of emergency visits, as well as the preventing emergencies occurring. And then how do we implement this? The first step is we partner with local clinics, with nursing programs, or with universities. One of the reasons why we do this with universities, it's because of the volunteers. Students can be volunteers if they need for their graduation hours, or there's organizations that they're in, as well as nursing programs. Many of the students need to practice how to perform these skills screening that is very essential in their career. Number two, it's hosting these events monthly, because if sometimes you do this a one-time thing, people don't take advantage of this and miss this opportunity, or as well we can do it quarterly to make sure that the number has not increased. And number three, we can promote these events and social media, which is a big impact, as well as schools with children's giving out the forms for them, or we can organizations like in churches, outside of like fast food restaurants, whatever it's needed. And then number four, we need to provide follow-up resources such as references of free or low-cost clinics for them to follow up. Let's say if their blood sugar was pretty high, to get their treatment, to see what education they need to know to provide a lower number. And expanding community screening is not only possible, but practical, affordable, and proven to work. Now that we know the benefits, not only do we help individuals, but we also strengthen the community. First, we are able to save lives for them, we prevent complications, and decrease the healthcare costs for them. You know, when something becomes very severe or an emergency, the cost does rise up. And then, according to the CDC 2022 data brief, preventive screening are widely used and effective when accessible. People do rely on the screening as an individual. And for the community, fewer emergency visits are being done in hospitals or in clinics, and they have a healthy family, stronger connections between the members and the providers. So to call this action, to make this for a long-term goal, we need to participate on the screening, encourage families and friends to join together, and we need to share these events going on. We need to support each organization, each member, because together we can build a healthier, safer, and more informed community by providing screening for any people that's needing it.